This presentation is a methodology discussion for our research titled Health Literacy with Visual Media, a student-centered approach to well-being. Introduction. The health promotion programs are important to improve health outcomes for adolescents, including improvements in their quality of life, functionality, independence and equity. To achieve these results, is determinant to understand how the social surrounds among adolescents affects their understanding of a healthy lifestyle and well-being. School is a privileged place for the development of prevention efforts. The systematic review of research has concluded that the approach of health-promoting schools might have a positive influence on schools' environment. Working with children and adolescents in a healthcare context is challenging. A key issue is to overcome potential communication barriers between adults and adolescents. Our research assumption is that the use of digital technology, such as smartphones, facilitates communication with adolescents. Research goals. Use a student-centered approach to map their perceptions on health and well-being related issues. Health literacy can empower children and adolescents to commit to their health care and provide self-management skills that will help to keep themselves well for the duration of their lives. Engage adolescents in their health promotion decision-making. Foster a communication strategy mediated by digital technology that encourage health literacy and well-being curiosity in adolescents. Provide health literacy to adolescents through Health in School program with a joint effort of the Federal University of ABC Medical School, and Santo André Health Secretary. Methodology. As this is a new topic of research that mix of fields blended together and it is becoming a new hot topic in design for health. We spent the last few months studying more papers to find out about the best protocol to be used in data collection, data analysis and results validation. We decided to merge the school well-being model and the framework for studying adolescents' health literacy together with Video Prevention Intervention Assessment, VIA. The school well-being model, which is a student-centered approach where the dynamics of well-being takes place at school. School conditions, having, social relationships, loving, means for self-fulfillment, being, and health status, health, are the main elements of well-being at school. The Manganiello's framework for studying adolescents' health literacy, which states that adolescents' personal beliefs, values, attitudes, and behavior towards health literacy depends on individual characteristics such as age, race and gender. Family and peers influence, given they are an important component in the lives of young people as they move into adolescence. And systems such as education, healthcare, and social media. VIA is a qualitative research method that uses visual anthropology knowledge to collect participant-created data in the form of student-generated visual narratives. Participants. Study population. We recruit participants from middle school aged 11 to 15 years with diversity of gender, race, ethnicity, culture, disabilities, and socioeconomic characteristics of the broader population. Sampling strategy. To get students involved, we will invite them to participate in an intervention. We will encourage them to join the workshop about the screenplay, storytelling, and short filmmaking. Also, we will teach them how to search for and select health-related information. Then participants will prepare the video diaries to develop their conceptions of health and a healthy lifestyle. They should interact with their peers, families, and system. Data collection. The VIA data consists of three major components. Clinical and Psychosocial Assessment Report, CPAR, which is a comprehensive medical history and psychosocial assessment administered as a face-to-face interview in a clinical setting. It elicits information on the participants' general and condition-specific medical status and healthcare needs. Health-related quality of life, HRQL, which is a standardized, previously validated instrument, appropriate to the age of participants. The current VIA study uses a general health status instrument, the KidScreen 52, that evaluates 10 scaled HRQL dimensions. Visual narrative, which is the core data of VIA. It is the documentation done by participants of their thoughts about health life experiences through their smartphones' cameras. Data management and analysis. The VIA data takes three basic forms. Verbal, which are transcribed from the CPAR. We assign codes to medical, psychosocial, and well-being information observed in the visual narratives, indicating data categories such as sports practice, eating habits, medication use, leisure activities, study routine, environmental factors, or psychological response to lifestyle. Statistical. We organize the scaled data from the HRQL instruments into a statistical database such as the open-source PSPS so we can correlate an individual participant's quantified health and psychological status before and after the visual narrative process, then comparing it with normed population data. And visual, which is the participant's narratives that is uploaded to files with superimposed readouts designating the participant, file number, and time code in hours, minutes, seconds, and frames. Using these numerical codes, researchers can note and communicate the locations of specific observations on the videos. Validation. We triangulate verbal, statistical, and visual via data to compare, complement, and possibly contradict each other. The CPARs bring historic and human details to the HRQL scales that in turn validated the CPARs with standardized data from a normed instrument. We then compare the via visual narratives with the CPARs to evaluate the participants' quality of recall and accuracy of verbal report. The CPARs add explicit and implicit non-visible information to what is shown in the visual narratives. The HRQL statistics provide quantified measures of physical and psychological health status against which the visual data could be interpreted. Whereas the visual narratives provide a real-life context for the domain scores arrived at by the HRQL. The different data types and analytical frameworks of the VIA method yield a multidimensional understanding of the phenomenon under investigation. When individual analyses are complete, overall themes that emerge from the visual, verbal, and statistical data are identified and areas of consonance and dissonance noted. In addition to enriching data analysis, triangulation is a powerful means of validating qualitative findings. Ethics community. Participants and their parents or legal guardians will receive materials with a precise explanation about the study. Informational documents include a cover letter, a flyer clarifying the survey content, and a data protection declaration. Adolescents and their parents or legal guardians must sign a written informed consent form. This project is under analysis at the Ethics Committee at the Federal University of ABC. This presentation is made by Basma Jalad with the great contribution of my supervisor Professora Luciana Pereira and co-supervisor Professor Anderson Ribeiro. This research is a part of the post-graduation program in Engineering and Innovation Management in Federal University of ABC. Santo, André. Brazil. November 2020.